Cannabis is a fantastic option for people that are suffering from IBS. If you have irritable bowel, or if you have Crohn's or a leaky gut, or have reached any of these diagnoses, cannabis is a wonderful starting point for you. So IBS, what you can expect when treating it is to have relief of the pain and the suffering associated with it, and in addition, having it make it where you're able to eat without having the horrible side effects and ingestion. We have found that patients do very, very well they do need the THC though. That CBD will help, but you've got to have that THC. You have to have a little bit of psychoactivity that helps with it. It's also, you have to treat the immune response. So we want to make sure that you do also have the CBD.
Some patients who are less comfortable with psychoactivity may want to consider a ratio that is more CBD rich, like a 4 or 5 to 1, meaning 4 or 5 parts of CBD to 1 part THC. Whereas those who are more comfortable with psychoactivity may find that they get benefit from an even balance of CBD to THC.
THCA is fantastic for anything in the gut, as is CBG, cannabidiol. Now, THCA is what the raw is that you find in the flower, and CBG is the cannabinoid that's present in cannabis plants when they're young, before the genetics of the plant say it's going to convert to THC or CBD or one of the other major cannabinoids. They all start out as CBG. And we say CBG, the G stands for gut. So if you have access to cannabis medicines or even the raw young plants before they start converting over, you can juice these. If it already has converted and it's now to THCA, which is the raw unheated cannabinoid, it's going to be very, very helpful to include into your treatment plan along with what you're ingesting as an activated THC and CBD. One of the things that we do with patients is oftentimes we'll give them something that they take every day internally. They ingest it, and then they can vaporize for breakthrough symptoms. If you're having a particular problem, you can do a little bit supplementally where you'll have a very quick response and a very quick relief of your symptoms from it. In addition, with some of these, sometimes you'll have fistulas. In this case, even using a suppository in those cases can be extremely helpful, along with the internal. So I want to make sure that I emphasize that using a suppository alone is not the answer. It must be in conjunction with taking something internally, sublingually, or ingesting it orally.
Patients with IBS may find that oral medications like tinctures, oils, and edibles may be the most effective. They may also find that they get benefits long-term from regularly engaging with those medications multiple times a day, constantly metabolizing those medications to see the greatest benefit over the longer-term span. Starting with a low dose and working your way slowly to increasing dosing is most crucial, regardless of what cannabinoids you're ingesting. For example, if you're smoking THC to address your IBS, perhaps it's best to just take one small hit off of the smoke or vaporizer in order to assess your body's individual response. If a patient is starting with CBD-rich medications to address their IBS, they might be able to start with a slightly higher dose, for example, 2 to 5 milligrams of CBD-rich medication, but it's still best to start slow and low and work your way through an increased dosing protocol. IBS patients may experience benefits from cannabis immediately, right upon their first consumption. That said, because IBS is an inflammatory disease, the patient may find greater benefits over a longer span of time with regular dosing.
I was told that I had IBS a number of years ago, and I was told I had to stay away from all sorts of different kinds of foods. I was told I had to do all sorts of crazy things. They were trying to put me on all these pharmaceuticals. But when I started using cannabis, I'm not on any of them. And I eat anything that I want. Now, as it is, I happen to want healthy foods, but I'm able to eat raw more, and I'm able to eat things without all the side effects. And I directly believe that cannabis is in fact responsible for that. We have the numbers of patients that are using it now to prove this out. The N is getting very, very large. Whether cannabis will cure IBS or Crohn's disease is an interesting question that I'm often asked. And I will say that it will put it in remission. I don't ever use the word cure in association with disease because of the way that the body works. It's one thing if they had a cold, if you have a cold and they figured out something that you could take and you would never have that particular germ that caused the cold again. That's different than treating a systemic disease within your body. So you may not have a cure, but to go into remission is the most that any of us can ever hope for in treating these chronic diseases. Now, that remission might last years and years and years, and if you continue doing all the right things, there's not any reason to believe that it'll come back. And if it does, you have the tools at your disposal to fight it. You can always use vaporization for any kind of breakthrough in case what you're using prophylactically isn't working as effectively. If for some reason it stops working and you're all of a sudden you're having symptoms again and you're concerned, that's when the beauty of the cannabis plant comes into play, because there are so many different options available to you on different cannabinoids and different terpenes and ratios and combinations. So if one stopped working, maybe we need to add something else.